This is a story you will definitely want to hear. A young mother of 3 children has an incredible story to tell and how the Ottawa Hospital impacted her life. I'm now joined by Gina Mertikas-Lavictoire. Hi, Gina. How are you?
Oh, hi, Sam. Good, thanks. How are you?
Good. Gina, this is really an opportunity for you to share your story and share the impact of the Ottawa Hospital, like I said. But let me take you back to the day you sort of realized that your life had changed.
Yes, that was about 3.5 years ago. My life changed tremendously when I got the diagnosis that I had breast cancer at the age of 34 with 3 small children at home. Having exercised my whole life, eat well, don't do anything too dangerous. It came as quite a shock to our family. But as soon as I found out, the first thing I said to the doctor was, when can I have my mastectomy, and let's just start my treatment. And from that moment on, I never looked back. I chose to not feel sorry for myself, ask why me, and I really decided to just keep moving forward with every step of the way.
Is there a bit of mama bear in that for you, knowing that you had those 3 small children at home?
That's right. So 3 really small children. My youngest was 1 at the time, and that was that's a whole whirlwind of a life already with 3 young kids under the age of 5. So to throw this into the mix, it really did come as a huge surprise. But I had incredible support from my family, from my husband, and we just tried to get through it as well as we could.
And you added yourself to the Ottawa Hospital family, because they certainly have a family there of care and support. Walk me through your treatment that happened at the Ottawa Hospital.
Yeah, so the Ottawa Hospital is fantastic. I am so happy to have them in our own city. We're very, very blessed with this world-class care. So once I found out the news, and I went into, survival mode, my first step was to meet with my surgeon, and from there we spoke about my next step. So I ended up having 6 months of chemotherapy, followed by a month of radiation, and then I had a mastectomy. And after my mastectomy, I actually had a preventative mastectomy on my good side, and as well a hysterectomy. So in total, I've had many surgeries in the last few years to just try to get rid of everything I possibly can. But the care at the Ottawa Hospital was phenomenal. So honored to have these doctors on my side. It's incredible.
We're so lucky. We have a world-class facility, institution here in Ottawa.
World-class. And the doctors, especially my doctor, Dr. Clemens, world-class leading physician and researcher. The research that they do, they're coming up with new trials. They're creating new cures for certain ailments. It's phenomenal. We're very, very lucky.
How do you tell your husband the news?
Well, interestingly enough, we were actually on March break, and we were all together in the hotel room when the doctor called. So I stepped away from the children and went into the washroom and closed the door. And my husband knew at that moment something was wrong, because we had been waiting for this call, but we decided to go to Toronto anyways because we had these plans for March break. So either way, my husband knew. One look at me and he understood, kind of tried to keep the kids occupied. And once I finished talking to the doctor and opened the door, there my husband was standing and, trying to, it's okay, we got this, positive energy, let's just move forward. Mm-hmm. And I'm happy to say that night I actually went to a Raptors game with my children because I was like, this is not going to stop me from living my life with my kids. So from that moment, I said, it's not going to change my life for the worse. We're going to live with it.
How important do you think that was, Gina, in your recovery and your outlook on life?
Yeah, I think it's extremely important, and this is what I tell newly diagnosed patients. I have a lot of people emailing me now, just based on my research, my fundraising that I've been doing. Oh, I just got diagnosed. What should I do? Oh, I don't know what else to do with myself. And my first thing is you really need to control your mind. Don't let your thoughts take you to a bad place. Yes, cancer is terrible. Nobody wants to get diagnosed with cancer, but there are a lot of people that do survive. So I try to tell anyone who's listening that you have to really get your mind in check, control your thoughts. Don't go down that dark path of death and I'm not going to come out of this. You must think positive thoughts only, and you must move forward. And don't stay and hold and say, why me? Oh, why did this happen to me? It did, and it's over. Just continue to move forward. And positive thinking will get you through every stage that you're at, whether it's a chemotherapy or radiation. This too shall pass, one of my favorite quotes of all time. And it really is true, because it's going to be over. And with positive mind and a really strong mind, you can confidently get through this.
And you really took that sort of energy and you turned it into an incredible fundraising initiative. Talk to me a little bit about what that means.
Oh, yeah. So when I had finished my treatment and I had one of my last appointments with Dr. Clemens, I said to him, how can I give back? I have to help give back to the hospital that has done so much for me and my family. And he said, well, research is very, very important, as we all know, and the REACT clinical trials, they need money to help fund their trials. So as soon as he said that, I was like, okay, done. I'm going to think of something to do. I'm going to, sell things. At this moment, I had no idea what I wanted to do. And then I left and I was speaking with my mom, who, as you know, is an artist. Mm-hmm. And so I said, Mom, what about if we do a calendar? Because people really like her art. She's pretty well known in Ottawa, especially. And she said, sure, I'll donate my time and I'll make you 12 paintings and let's make a calendar. And the first year I sold out within a week and a half of making the calendars. And that was in 2018. And it's 2020 now, and I've been able to donate $25,000 plus since then, and growing, because my 2021 calendar is still not even sold out yet. So we are on par to make even more money for the clinical trials, and I'm so happy to be a part of that.
What's it like to tell your mom? I know you and your mom are very, very close, and your mom is a renowned artist, as you mentioned, of course, Katerina. And what was that conversation? How does a daughter tell her mom what she's going through?
Well, it's very funny, Sam. Like you said, we're really close, and she was actually in Toronto with us on March break.
Okay.
We had brought her along to help watch the kids, so my husband and I could have some, dinner time alone, so she could babysit. So she happened to be there, which I do actually think is a little bit of a blessing, because then I didn't have to make the phone call or go and see her in person, because she knew as soon as I went into the bathroom and took that call that there was something wrong. So I didn't actually have to break it to her, but she was with me every step of the way. So we knew something was coming. So we had our minds a little bit ready for that, but of course it was a shock for her. I still don't really think that she is fully recovered from it.
Well, I can definitely tell that you are her daughter. And I'll tell you why. Is because she is just someone that gets things done. And the duo of you and her and these beautiful calendars is just totally makes sense to me. When I heard that she was doing this initiative, and I knew your story, of course, this just totally made sense to me, because you're both just, really driven and community oriented. Walk me through the minute you sort of shared that with Dr. Clemens, what your plans were.
Well, I told Dr. Clemens, I'm going to work on something for you. And at the moment, I didn't know what I was going to do. But once I started thinking about the calendar, he connected me with the Ottawa Hospital Foundation and their wonderful staff there, who really helped along the way. Mm-hmm. And even to date, they have my own webpage on their Ottawa Hospital Foundation website. You can click and buy a calendar online. You can pay online. So they've really helped me spread this apart to the community, because there's only so much I can do. I have family and friends, but them putting it on their website has really been able to go even across Canada. I mailed one to in Vancouver just last week. So I think it's incredible, and I really hope Dr. Clemens appreciates this. I wanted to definitely do something to give back to him and his incredible program and all these amazing doctors. So I hope to continue this as long as I can, and even add more fundraisers. I only wish I could give more. I really do.
It's amazing, Gina. I've got actually 9 originals of your mom's work. And, Katerina's been a really big part of our family in terms of her art, adorning our walls, if you will. And I think this is a really important piece to note for listeners that don't know your mom's work, is your mom's work is hopeful and it's joy-filled. And I think that's a really important part of your story, because you were, as you've shared, really trying to take this on with the most positivity that you could.
Yeah, that's exactly it. I find that we all have to live by hope. We have to have hope that things are going to be okay. Even with the current situation in the world, we have to hope that COVID-19 will end, So hope is a huge, huge part of my mentality, and I really try to put it on other people who want to listen to me. But I do think that we need to be hopeful for the future. And I have 2 daughters as well, so I don't want to have them have to grow up in a world where, there's no cure and research is not evolving. I want them to be able to be older, and if something happens, they can know that there's something that's going to treat them. There may be a cure. There's a medicine that they can take. So this is why I'm really big on the giving back to research for the future.
It really is the future, and I'm so happy to say that you're going to stay with me the whole hour. I'm thrilled, and we're also going to have an opportunity to speak with your doctor, Dr. Mark Clemens, and we're also going to be speaking with the president and CEO of the Ottawa Hospital Foundation. Of course, that's Tim Kluk. So this is going to be an opportunity today to not only sort of share your own personal story, but really inspire others and shed a lot of light into, what happens at the Ottawa Hospital when this type of news comes your way. So I'm really happy to have you share your time with us. If you were to sort of share one sentence, Gina, about the care you received at the Ottawa Hospital, how would you describe that to someone that maybe isn't familiar with the incredible care at our hospital here in Ottawa?
I would truly describe it as world-class care. Facility, doctors, nurses, the entire package. It's an incredible facility. We are so lucky to have this hospital in our own city, and this is why it's so important for me to give back to our own community.
I don't know about you, Gina, but I've thought a lot about our healthcare professionals during COVID-19, and I have thought, of course, about all our friends at the Ottawa Hospital. Have you as well?
Of course, yeah, all the time. I've also had a surgery just a few months ago that had to get postponed due to COVID-19 in the spring, but it's an elective surgery. It wasn't something that had to be done, so I had no problem postponing it. But I can't imagine these doctors and nurses and hospital staff working so hard for us, like they always do anyways, but it's like it's a little bit different this time,
Agreed.
Just something about COVID is, so please keep your masks on and
exactly.
Let's do our part.
Well, we're going to come back with Gina Mertikas-Lavictoire, of course, and Dr. Clemens. Stay with us here on An Hour to Give. We're following along with the incredible story of Gina Mertikas-Lavictoire and her story with the Ottawa Hospital. We're now joined by Gina and her doctor, Dr. Mark Clemens. It's so great to be with you today and to hear, your impact on Gina's life. Do you remember meeting Gina for the first time?
Oh, Gina and her mom are a phenomenal and lively presence. So yes, indeed, I remember that day. And my life hasn't quite been the same since.
I believe that. I feel the same way. And Gina, when you hear Dr. Clemens, even his voice right now, what does that do for you?
Oh, Dr. Clemens made me feel so comfortable the first day I met him. You're going in with the worst possible news, and the look on his face and the jokes that he made right off the bat put us all at ease. We were laughing in the middle of our very first diagnosis appointment. So he puts a smile on everyone's face, and I can't thank him enough for that.
It's such an important aspect of providing healthcare, I think, is that human side. Let's talk a little bit, Dr. Clemens, about your role at the Ottawa Hospital.
So I'm a breast oncologist, so I meet women and men with newly diagnosed breast cancer, and I view my job as taking them through on this journey, hopefully for cure. And the majority of the time our patients are cured, but also dealing with the ups and downs of what a cancer journey can involve. Because as Gina said, it's not all laughter. There's a lot of very sad and tough times, and it's the ability to deal with the tough times, dust yourself up, and keep moving forwards that keeps both ourselves as oncology professionals and the patients on the same page.
Gina, we've heard from other cancer patients in the past that, when they've got a great relationship with their doctor, they feel that comfort that you described, that the doctor almost becomes part of your family. Did you feel that way about Dr. Clemens?
Oh, I wonder if Dr. Clemens would like to be a part of my family. I would welcome him with open arms into our lovely home. We loved him. He put us all at ease. His smart brain really helped us. So, I didn't have to see him as often as I'm glad I didn't have to see him too often, actually. No offense, Dr. Clemens. But I'm very happy to have had him in our life.
Dr. Clemens, how long have you been practicing for?
Oh, this is my 29th year.
And what changes have you seen over that just about 3 decades of care?
I think what the major change we've seen with respect to breast cancer care is the fact that compared to decades ago, women now come forward much sooner to the healthcare system than they used to. So the taboos of finding something not quite right with your breast and coming forward, letting someone know, has probably been one of the major changes. I think the other major change has been the advances in our treatments, be they surgery. So surgery now is much smaller than it used to be. The radiation is much more focused than it used to be. And our drug treatments, thanks to advances in pathology and the drug treatments, now mean that most people coming forward with breast cancer are cured.
And it's really important to note, too, Gina, that I believe, as I read your story, that you actually did come forward with what you thought was abnormal in terms of your breast, correct?
That's right. Yeah, that happened to me as well. But due to my age, at 34, I was actually dismissed by my family doctor a few times. She kept telling me, there's nothing wrong with you. You're fine. It's probably from breastfeeding. So I really did trust her opinion. And only after some pushing from my family did I go back to a different doctor who ended up biopsying it, and then we found out the news. But because of my age, a lot of doctors were saying, you're so young, you have zero family history. And I'm sure Dr. Clemens can correct me, but I know a lot of young people who get breast cancer. It is not an old woman's disease, and I think that is a misconception that many people have.
Really interesting. I think that's really important to note for sure. And Dr. Clemens, I understand there's a program called REACT. Can you tell us about that?
I can indeed. Well, when you are as devoted to breast cancer research as I am, it's a lonely battle trying to improve cancer care. It's lonely because it feels like you're faced with barriers all the time of how many hours do you have in the day, how many questions do you want answered, and obviously donations and money are what make the world move forwards. And so back about 10 years ago now, we started having talks with Dr. Ferguson in the Method Center here at Ottawa about can we change the way that we do cancer trials to make them more patient and patient family focused. And that's what REACT stands for, is the rethinking of clinical trials. And the amazing news is in a few short years, over 2,800 patients have entered our trials, making Ottawa by far the largest cancer practical trials program in Canada. And Gina will probably tell you more about these studies because she's been involved in several studies that have changed the treatment of cancer across the world.
Wow, Gina, that's amazing. Tell us about that.
Well, yeah, that's pretty incredible. It was a program. I was part of the trial of a certain type of injection that I had to give myself for 10 days. And I don't really know all the technical terms, but the study concluded that 5 days was just as effective as 10. So that reduced the cost, number one, and it also reduced the side effects of this specific drug. So that's going to help many, many patients moving forward.
And when you think about the research and everything that's gone on, of course, you referenced Dr. Clemens, how much it's even changed in your 3 decades of caring for patients. How important is it that we keep funding research?
Without funding, none of these great ideas will move forwards. And as Gina and her mom will tell you, when you're faced with a diagnosis of cancer, you're fighting for your life. And you want to know that the treatment you're getting isn't the best treatment of today. You want to be getting the best treatment of 5 years from now, into the future. You want to be at the front of cutting-edge treatments. And the only way that can be done is through research. And clearly, without funding, the research doesn't happen.
And we referenced earlier, Gina, how important it is to have that research right in our own hometown. I mean, we think about Ottawa, of course, it's the capital city of this beautiful country, but it really is our home as well, and we want that close to us. How crucial was it for you, do you think, in terms of your care and obviously being a cancer survivor, to have that really just down the street?
Oh, it's very important. I also I had a friend who was diagnosed out in the East Coast who actually moved to Ottawa to get our world-class facility treatment because they just did not compare out there. So we're so lucky to live in this city and have this facility and this campus available to us and these doctors as well.
And Dr. Clements, how inspired are you about other researchers, maybe up-and-coming researchers that you're working with, what's happening right here in our own town?
Oh, I think you've hit on several really important things. I think we have to realize what a phenomenal center, and I know I'm biased because I work here, but as you can tell from my accent, I'm not from these parts, and I'm extremely proud to work here, and realizing the fact that we are delivering world-class treatment. This is not some sort of cliche. The reality is when Gina's sitting in front of me, she's getting their best. With respect to my own old age, I think an essential part is the training of new healthcare providers. So that's not just doctors, it's nurses, it's pharmacists, in the realities of how difficult cancer and its treatment are for the patient and their family. And that's why the REACT program will do many surveys of patients, and our patients are wonderful at filling them out, so that we can actually find out, yeah, you got your treatment, but how could we make it better for you? And I'm delighted to say that our younger generation of healthcare providers are now leading their own trials that are helping patients not with just breast cancer, but also prostate cancer and colon cancer. So these are exciting times.
It really is interesting. You've referenced a number of times the patient and their family, and that certainly is different from 20 years ago, right? I think cancer is and can be a very lonely disease, but when you're treating not only the patient, but the family as a whole, is that the sweet spot of being able to ensure someone gets that full spectrum of care?
I think you're hitting on a very interesting point because oncology is tough, and a lot of my colleagues from other subjects will say, oh, my goodness, how do you do cancer treatment? But I think it's the unique relationship that we have with patients, dealing with patients at probably the worst time in their lives when they've had a new cancer diagnosis, and kind of letting them know, you know what, let's move forward, let's see what we can do, and let's see what we can do to improve care and make it better for you. And I think your example with Gina's mum, and I'm sorry we keep talking about Gina's mum, is Gina's mum held the whole team together throughout her treatment. She's a stunning lady.
She is. That does not surprise me one bit. Gina, how important was it for you to ensure that your family was part of this solution?
Well, I don't think I had much of a choice. I'm from a Greek family
yes.
who are involved in everything no matter what we do. So, but it was nice to have the support. Obviously, I have a husband and my family, my sister, my husband's family. It's kind of a big community involvement. I had 3 young kids. I did not have time to take care of them when I was trying to fight for my life. So everyone kind of chipped in, and it was really, really important to have all of them there with me.
Really, it is amazing. I love that we're sharing this story, not only from your perspective, Gina, but of course from the perspective of Dr. Mark Clements. We're going to come back with Gina Mertikas-Lavictoire and Dr. Mark Clements. Stay with us here on An Hour to Give. If you are like me, you are completely inspired by the story of Gina Mertikas-Lavictoire, and I am so happy that you are here with your doctor, Dr. Mark Clements. Gina, if you think back to the first time you met Dr. Clements, did you ever think you'd be sharing time on the radio with him?
Oh, definitely not. This is pretty exciting. But I'm happy to be able to be here with them.
It is pretty exciting, and I think what's really fantastic about it, Dr. Clemens, is I understand right away Gina said, I want to give back to the Ottawa Hospital, and you encouraged her to do that. Let's talk about when you heard about, of course, Katarina's beautiful artwork, her mum, Gina's mum, that does here in Ottawa, of course, very talented, worldwide renowned artist. What did you think about when you heard about the calendar for the very first time?
Oh, as we said, this is a phenomenal and unique family. And as Gina points out, everybody in the family has great skill sets, but her mum's paintings are absolutely stunning. And therefore, when she sort of said to me, when the treatment was going so well, how can I give back? I think that's where we can all work together. Because, as you can imagine, in my clinic tomorrow, there's going to be patients like Gina was back then who are beginning this long, tedious, and awful journey. And to be able to say to patients, other patients have been there before, and what they've done is, through clinical trials and working with the Ottawa Hospital Foundation, has enabled you to get your treatment, your curative treatment, with as little toxicity as possible.
Really so important. And, obviously that physical healing is key, Gina, but was the giving back to the Ottawa Hospital part of that mental healing, that emotional healing?
100%. I feel like there's many different types of people in the world, obviously, who go through things however they go through it, but some go through it quietly in their own world, and others, like me, want to talk about it to help other people. I mean, I have inspired many people who have told me, I've gone to get a mammogram for the first time because of you. I am now more aware of my body because of you. So sharing this story is not just for myself, and it's to help other women going through this. And like I said earlier, I have 2 daughters. So I'm trying to raise awareness so we can keep making money, so we can donate to this incredible research that's happening in our own city. So
wow.
It was very important to me to give back. It wasn't even a question. It was, I need to give back. What can I do for you? And like I said, I wish I could give him more. I wish I could give the trials more money. But we're working on it.
Every single dollar that goes towards research and those clinical trials is so crucial, Dr. Clemens. And Gina shared with us, $25,000 so far in terms of her fundraising. Where do those dollars go?
That's a fabulous question. And so research comes in many different shapes and forms. As somebody who sees cancer patients, a great part of my team is making sure that all the members of the team actually meet patients as they're going through the challenges of treatment. Because ultimately, unless you actually see someone, see the tears, see the laughter, you don't know why you're doing a particular job. And I think that's one of the wonderful things about the REACT program is everybody is involved, everybody meets patients, so they know why are we doing these particular programs. So, for example, at the moment we have a massive program about to start, if we can raise enough fund, for looking at hot flashes. And for younger listeners, they might not know what hot flashes are, but for the vast majority of women, and particularly breast cancer patients, they can be an absolutely debilitating side effect of breast cancer and its treatment. So the funds that we raise in this particular example, and the reason we're doing hot flash research is because patients ask for it. And we use the funds to, first of all, do a review of the whole world's literature. We have a team, including Brian Hutton here in Ottawa, who are world-class researchers at looking at what people have done to find out what the best treatments are. We then use the funding to actually do incredibly large surveys of patients, particularly in Ottawa, to find out what can we do for you? Which treatments worked, which didn't? Because, for example, with hot flashes, some people will use over-the-counter herbs, others will use antidepressants. Let's find out how it helps. And then ultimately, our plan is to design a trial where we find out what's the best. What is the best in the world, and what can we offer patients? And so for Gina, for example, with the injection study that we showed that patients don't need 10 injections, 5 is more than enough, we were able to change practice across the world using relatively few healthcare dollars.
It really is amazing. You know, the term that keeps coming to my mind as I hear you speak between the two of you is it's almost like you've created this incredible partnership. You're providing this incredible care to Gina. Gina gives back to you and you care for more people. It's this beautiful cyclical partnership. Gina, do you sort of see it that way as well?
Absolutely, and I hope to be able to give back to Dr. Clemens and his team for many, many years to come. And I find it's just a sense of community. I'm done my treatment, but that doesn't mean that we have to stop funding research because I'm done. You know, there's many, many patients to come in the years and generations that we're going to help. So really, it's a community involvement and the future.
Dream for me, Dr. Clemens. Where do you think we'll see this type of research, the type of outcomes in 2030? If you and I were sit down in 2030, where do you hope to be in 2030?
Oh, if I was alive in 2030, I would be pretty thrilled.
You will be. We need you.
What I think is going to happen is, as our population ages, we're going to see more and more patients with cancer. And I think COVID-19 has been a disaster from a cancer care delivery point of view because patients are presenting later than they used to. So my hope is that in 2030, the patients that we're seeing will have smaller cancers that we can treat with less and less noxious treatments. So hopefully there'll be less and less chemotherapy. In Gina's case, she was able to receive a very interesting antibody treatment against her sort of breast cancer. And so what my big dream would be, the treatments are less toxic, patients tolerate them better, and they get back on with living. Because I think what COVID-19 has told a lot of us is life is short and we need to enjoy it more.
Oh, beautifully said. Gina, what's your dream if you and Dr. Clemens and I all get together in 10 years? What's your story?
Similar to his, less toxic treatment because, as we know, chemotherapy is pretty hard on the body and on cells that don't need to be affected. So that would be really nice to have a treatment that is targeted towards your cancer and not just your whole body. So I would really like to see some advancements in that, and I'm thinking we're on our way. I really am.
It really is inspiring. And of course, Dr. Clemens, this has been a time where, we've had to face a number of things in our healthcare system. Well, what's your biggest fear when it comes to this type of time in our lives and cancer treatment?
Oh, by far my biggest fear is I have seen cancer treatment improve over the decades, and public awareness, in particular things like colorectal cancer and breast cancer, where we have screening tools, and I've seen it go hayward in the last 9 months. And it's tragic to be seeing things get worse when they have been improving so much for so long. So these are not good times, and they're concerning indeed. And while we're still delivering as best treatment as we can, things are challenging.
For sure.
For everybody.
For sure they are. Gina, does that drive you even more?
Yeah, we need to keep funding all the research that we can. So I'm going to continue my fundraising, get some more money back. Yep. It
really is inspiring. And as we sort of think towards this incredible calendar that Gina and, of course, her mother illustrated, Gina Mertikas has illustrated, do you have one of those hanging in your home, Dr. Clemens?
Oh, well, I think I have more than one.
Yes, absolutely.
He'll get the 2021 calendar. Dr. Clemens, I will send you one.
Amazing. And I can imagine, too, that it's inspiring for the whole team, Dr. Clemens, to know that a patient has taken this kind of initiative to raise funds for the Ottawa Hospital.
I think you hit it again on the nail. It's a two-way street, and the inspiration flows both ways. And what we need to do is use this inspiration through the Ottawa Hospital to continue to improve the care of cancer patients, not just here in Ottawa, but across the world.
Really is so important. And when you think about that global effect, I don't think, Gina, we've ever thought about sort of our planet as a whole as much as we have over the last number of months. It's really remarkable to think you've had that global impact as well.
Well, yeah, when I read that part of the study, it said worldwide result, like this is now going to affect the way patients are using this specific drug worldwide. That's incredible. It's amazing. Just so proud to be part of this program.
And Dr. Clemens, when you speak with your colleagues across the world, what are their thoughts about the Ottawa Hospital and the work that's being done?
I think repeatedly I hear from my colleagues internationally that, wow, you've really taken a very different direction in your research program, because most research that's happened is not very practical. Our trials are extremely practical and run at relatively efficient costs. And you can see, and as Gina said, it's pretty amazing when I can look in a patient's eyes here in Ottawa and say, did you know, all the way across the world in New Zealand, your trial that you were involved with and you were involved with the design of is changing treatment everywhere. It's a wonderful feeling, and I think it's great that in our little city of Ottawa that we are changing things for so many people in such a positive way.
And is this a silver lining, Gina? Because I can imagine it's been a rough number of years for you going through your treatment and dealing with so many things you've dealt with. Has this been the silver lining in it all?
Well, this has been incredible for me because some people, like I said, when they finish a terrible situation like going through cancer treatments, they want to just close off and not think about it anymore. But by me bringing it out there, I've met so many other people who have been telling me their stories, and my daughter was seen at the hospital too, and I've made so many connections, and I really do hope that it inspires other people. So yeah, it's been really wonderful to sell these calendars and to make the money for the hospital. And like I said, I really do wish I could give more, and I'll think about that for the future, but it's just something that's really important to me.
It certainly is, and you've made it important for so many of us, so thank you for that. Dr. Mark Clemens, thank you. It has been my honor and my privilege to spend time with you today. And Gina Mertikas-Lavictoire is going to stay with us. We're going to be joined in a minute by Tim Kluk, of course, President and CEO of the Ottawa Hospital Foundation. Stay with us here on An Hour to Give. An Hour to Give is an opportunity every single week to talk about inspiring people, and Gina Mertikas-Lavictoire is absolutely inspiring, and I'm so glad to have you back with me, Gina. And you've brought a friend. Our friend here at 1310 News, of course, is Tim Kluk, President and CEO of the Ottawa Hospital Foundation. Hi, Tim.
Hi, Sam. Hi, Gina.
Hello.
And Tim, it is really amazing to see what Gina has done with this incredible calendar. When did you first sort of hear about this initiative, and how did it make you and the team feel at the foundation?
Well, it's been a few years now, but I think what's incredible about Gina's story is someone who at a very young age was faced with an incredible health challenge, and obviously thank you to folks like Dr. Mark Clemens, who you had on earlier, and the tremendous team at the Ottawa Hospital. Gina was able to turn that tragedy and incredible life experience into something incredibly uplifting. And the collaboration with her mom and selling these calendars is remarkable. So taking that life experience and turning it a complete 180 to benefit others and really pay it forward for cancer research and cancer care.
Really is incredible. We spoke about so many different aspects of this. Gina, what was it like for you to hear about the foundation and that incredible team for the first time?
Oh, they were an incredible team. When I had asked Dr. Clemens what I could do to give back to this amazing hospital, and he told me and put me in contact with staff at the foundation, they right off the bat took me under their wing. They've made a web page on the Ottawa Hospital Foundation website. People can one click, you can buy my calendar, make a donation. They made it very easy for people to help donate to my cause, which in turn will pay it forward for everybody else. So they've been incredible, and I'm so happy to be a part of this donation process.
And of course, Tim, you get to meet incredible people that come to the Ottawa Hospital looking for that care. Let's talk about how you're going to honor some of those people this year.
We're really special campaign. And Sam, as you know, this fall period and leading up to the holidays is really important time for charities. And we thought this year, in light of everything that we are living, in light of everything that our frontline care workers are doing during this crazy COVID time, that we thought what would be more fitting than to reach out to our community and to encourage them to make a gift to honor one of our frontline healthcare workers. And for the Ottawa Hospital, that's 9,300 individuals who are there working on all of our behalf. So we're reaching out to the community to take this special moment in time to consider the Ottawa Hospital and make a gift. And we hope at the end of this campaign, at the end of December, that we'll have received 9,300 gifts.
It really is a wonderful initiative. I think that is a lovely way to recognize the sacrifices, the dedication, the real endless time that people have dedicated to their work at the Ottawa Hospital, Tim. I think that's fantastic. This year, of course, has been such a challenging time to raise money. I think, we know of the Ottawa Hospital holding incredible events. Many of those have had to either change or, be canceled. So let's talk about the importance of fundraising, especially in this crucial 5 or 6 weeks leading up to Christmas.
Absolutely. And the Ottawa Hospital Foundation is not unlike other businesses where, faced with the global pandemic and our commitments to the hospital and the Research Institute, like those needs don't end just because we're in a pandemic. So like other businesses, we really had to shift and we were forced to cancel all of our events, save and accept a community breakfast that we did virtually. I think the word pivot is really overused, but I'm going to use it anyway, that we really had to pivot and look at ways to do things differently. And I guess this also speaks to the importance of initiatives like Gina's, that these are, community leaders stepping up and finding unique ways to support the Ottawa Hospital. And I would be remiss if I didn't say to your audience that if they're looking at making a gift to the Ottawa Hospital at this time, what's great about our current campaign is we have two incredible longtime donors to the Ottawa Hospital, Mark Koo and Ian Nicol and the Nicol Foundation, who have agreed through this campaign. They're going to match everybody's donation to a maximum, get this, a maximum of $750,000.
Wow.
So no better time to make a gift to recognize the leadership of the Ottawa Hospital and our caregivers than right now and honor one of our frontline workers.
Really is so spectacular. And of course, you've got another creative way for people to get involved. Let's talk a little bit about the lottery.
Yeah, so again, this was a bit of the blue skying, right? If we can't do in-person events, what could we do to draw the attention of the community and create just one more way, one more avenue for the community to support the hospital? So we launched the Creating Tomorrow Lottery. It's a 50-50 draw, and our draw is going to be made just before Christmas. It's going to be made on the 22nd of December. Who wouldn't love to win a bunch of cash by the end of the calendar year, just in time for those New Year's bills? Creating Tomorrow Lottery, it's a 50-50 lottery. The more tickets we sell, the greater the jackpot. So the jackpot right now is just above $50,000. So, incredible check to receive simply by buying a 50-50 ticket. We think of hockey games and other sporting events to get you 50-50, but your listeners can go to creatingtomorrowlottery.ca, and tickets are $5 for $10, $15 for $20, or $100 for $50. So what is amazing to us, we're having a lot of people purchase the $50 package for 100 tickets. So again, creatingtomorrowlottery.ca is a way to participate.
And the other, thing that I think about this year, especially with COVID-19, is you had an emergency response fund as well. How's that doing, Tim?
It's gone exceptionally well. And when COVID hit, and let's go back to about April, we had an outpouring of support from the community that wanted to fund PPE or other innovative research projects. So we created this special fund, and we worked with the hospital and the Research Institute where they created an ideas hub to garner ideas from frontline staff, physicians, researchers to combat COVID-19. And I'm thrilled to say that the community has contributed just under $2.1 million for COVID relief efforts at the Ottawa Hospital. And that's gone to purchase equipment. It's provided frontline care, but it's also funded 19 research projects that are underway here at the Ottawa Hospital. Great projects, some of which have been in the news as recently as this past week. So incredible response from the community.
It really is incredible. And when I think about the grassroots work of Gina as well, it's really feeling like it's really creating that better tomorrow. Is that how you feel, Gina?
100%. Yeah. From every step of from my diagnosis to my treatment, I always said, let's just move forward. Let's think about the future. And this is exactly it. We need to create a better future for the next generation and the next patients to come through those doors.
And we're always thinking about that, right, Tim? I know there's obviously big plans for a new campus and all of those great things for the Ottawa Hospital, but we are thinking forward. We are thinking, to 2030 and 2040 and what that looks like for our children and our grandchildren. Does that drive you, Tim, especially in a challenging year like 2020?
Absolutely. It really is all about the future. And I know for all of us listening, we're just looking forward to getting together with friends and families and getting back to normal activities. It's been so long, it's hard to remember what that looks like. But it is about tomorrow. Just as you mentioned, Sam, we're planning to replace the aging Civic. And believe it or not, that Civic campus that we all know today was built 100 years ago during the Spanish flu. So it's kind of ironic, here we are 100 years later, that we're building a replacement to that hospital campus. So exciting to be in that planning phase now. And tomorrow is about funding research. And a big part of what we do at the Ottawa Hospital Foundation is investing in innovative research, which creates the treatments for the next patients.
Really is so crucial. And Gina, remind us where people can get that beautiful calendar illustrated by your beautiful mother.
Oh, thank you. If you go to the Ottawa Hospital website, there is the Ottawa Hospital Foundation link that they can follow, or you can just type in Gina Mertikas 2021 Calendar of Hope, and you'll find a link to be able to purchase it online, or again through me at gmertikas@gmail.com.
Really is so exciting. And Tim, I think these make great gifts as well. People are looking for innovative ways to give back to the community and maybe to their colleagues at the office or their friends and family. This is a great give back.
Absolutely. And I think we heard Gina say earlier that we're getting close to being sold out. So people should reach out today and order your calendar. It's a great idea. I know we talk. A lot of us deal in digital calendars, but it's always great to see a beautiful calendar. And just as Gina said, you can go to ohfoundation.ca and you can find Gina's calendars there on our foundation website.
And a great place, too, to make that gift as well, Tim. I think that's an important piece as well, that, we want to recognize those 9,300 heroes at the Ottawa Hospital.
Yeah, and there's no better time than today, right, is just going online and ohfoundation.ca. It's really simple to do, and your gift will be matched dollar for dollar, which I think is incredible.
Making that gift today for the future of tomorrow. Gina Mertikas-Lavictoire, so grateful for your time today. Really appreciate you sharing your story with us. And of course, to Tim Klug, President and CEO of the Ottawa Hospital Foundation. Thank you both for joining me today.
Thank you so much for having us.
Thanks, Sam.
It's been my pleasure. And make sure you reach out to the Ottawa Hospital Foundation to make your gift today.